Guys, let's get started. So welcome to the Functional IASTM webinar. It's July 20th, 2016 today. So if you're unfamiliar with IASTM, we're actually going to take you through a little bit about what it is, how it can help your practice, and a lot of our case studies and how people actually use this technique to generate more income in their practice or generate more income in their lives. So a lot of people have a hard time, a lot of practitioners, trainers have a hard time investing in a program, learning a new technique, and not sure how it's actually going to help their practice or benefit their patients. So we're going to take you today of how exactly that we have a lot of our clients that use specifically the M2T blade to help get better results for the patients, create more revenue in their practice, and actually live a better life. So before we start, let's talk a little bit about our company. So we're actually called Innovative Health and Fitness Education. We're the developer of the M2T blade and Vigor Kinetic Tape, which is actually a kinesiology tape. So we run M2T blade seminars, and we also run kinesiology tape seminars. We also created the Vigor Tape and Kinesiology Tape education platform, which is right now in Canada, USA, Philippines, and throughout parts of Asia. We develop proper courses and utilization on M2T, corrective and mobility, exercise selection, and integration into practice. We currently have two locations. We're currently located in Stony Creek, Ontario, which is just about a half hour outside of Niagara Falls, and Pompano Beach, Florida, USA. So our primary business is we have courses for trainers, therapists, students, and doctors. We're primarily an education company versus a tool company. So our goal is to provide proper education, not just about tools, but on overall functional assessment, muscle testing, anatomy, and corrective exercise selection. So today's webinar. So again, a lot of people that are on this webinar have only heard of instrument-assisted soft tissue mobilization or haven't heard of it at all. So I'm going to take you through about this actual technique and a little bit about the behind the scenes of it. We'll also go into about the theories and principles. And the whole purpose of our webinar today is how can I prolong my career, increase my treatment outcomes, and make more money while doing this. Then we'll go through some case studies of some really cool therapists and trainers actually using this technique to get better results and get better and create more revenue from their patients. So a few extras. So please ask questions. So there's a button on your screen where you can type in questions. Now, as I'm going through this webinar today, we may not be able to get through all the questions as I'm going through this, but I'll leave some time at the end to answer any questions or concerns that we may have. So feel free to ask some questions. You will get a recording sent to your email. So again, if there's something that you miss, I know I can talk a little bit fast when I get excited about this. So if there's something that I skim over pretty fast or that you missed, don't worry, you will get a recording of this within the hour of it being done. And have fun. So this is a great technique. I love teaching this stuff. I teach it currently in about 20 countries right now. So again, have some fun doing this webinar. It is a great thing. So a little bit before there's actually a slide at some reason why it's deleted here. So a little bit about your presenter today. You should know who I am. So my name is Adam. I'm actually the Education Director at M2T and Innovative Health and Fitness Education. So my role within the company now is I help run education seminars across the world. So in less than 24 hours, I actually head out to Delhi, India. We're running a seminar series this weekend, and then from Delhi, India, we go to Mumbai. I come back to good old Canada, and I head out to Vancouver. We're running a new seminar series out in the west coast of Canada. And then I head back into Asia, so we're going to the Manila, Philippines, we're going to Malaysia, and then we're going to Singapore, and back over into India. So I spend most of my time so far in 2016 in Asia. I've been back and forth from Asia 3 times since April. This is going to be my 3rd time going back to India since April as well. So my role in the company is to help educate and help set up education platforms in these different countries. So I really love bringing this program to different countries, new therapists and trainers. So one thing that I like is that our program is actually one of the top utilized programs in the world. We're actually featured in 33 countries right now. We only teach in 20, but we're actually in 33 countries. And our goal is to be in about 40 by the end of the year, which we want to do. So my background is I'm a sports therapist and trainer. I'm actually one of the ones that developed this program with a chiropractor and an osteopath. As I have a big functional integration method to this. So I currently have 2 offices in Burlington and in Stony Creek, which is in Ontario. We primarily focus on a functional medicine approach to health. So we go through all the functional assessment, corrective care program, weight loss, and pain injury and pain prevention. So our goals through our clinics and our fitness facilities is to help people, we screen them and help them move and feel better utilizing instrument-assisted soft tissue mobilization, exercise, and proper eating habits. So that's a little bit about me and my role in the company and what I do. So what do you think IASTM is and how it can be incorporated into your daily practice? Now, one of the questions we get, whether it be Facebook, Twitter, Instagram, is this technique has been around for a long time, but we still get a lot of questions about what is it? How is it done? It just looks like a metal tool. Is it gua sha? Da, 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 da. So IASTM stands for Instrument Assisted Soft Tissue Mobilization. It's where we use a specifically designed tool to help locate and minimize myofascial adhesions. One of the biggest things with instruments is it saves your hands and decreases your treatment times. What we're going to talk about today is how that can lead into better patient satisfaction, better results, and increasing your revenue throughout your practice. So how you can actually use this to make more money and help more people along the way. So a little bit about IASTM. So IASTM is Instrument Assisted Soft Tissue Mobilization. It's a new form of treatment of the fascia and connective tissue. Now, when we say new form, our blade is new. It's actually been around for 8-9 years now. We're almost at our decade mark and still going strong. But Instrument Assisted Soft Tissue Mobilization has probably been around for over 2,000 years, from using jade stones to rocks to plastic. The new concept where we use a stainless steel version is fairly new. So a newly developed tool allows the therapist in an extremely efficient way to locate functional disorders of the connective tissue and to treat. So now the MTT blade is that we use it for both an assessment and a treatment. So you can help locate myofascial adhesions, specifically where it's causing the dysfunction, and you can also treat it as well. So again, like when I talked about before, that's going to help decrease your treatment time and increase your overall patient satisfaction. Instrument-assisted soft tissue mobilization is carried out with an ergonomically designed tool called the blade. With the aid of fascial restrictions, can be detected and treated. It will allow for rapid localization and treatment of fibrosis, chronic inflammation, and degeneration. The ergonomic design of the blade allows the therapist to track down adhesions in the fascia and treat them with a reasonable pressure and thrust technique. Now, if you haven't seen our blade, so if you're on the website right now, go to m2tblade.com. You actually see a picture of the blade right there. So it's an all-in-one tool. There's a lot of tool companies out there that have multiple tools, 7, 8, 9 tools. We're an all-in-one. So we developed this tool that you can achieve results at any part of the body just using one tool, which kind of pushes us ahead of all the other tools out there as well. So we designed it that it can work in anybody's hand and that it's very easy to use on any patient. We also designed it so there's a 35 and 55 degree angle on the actual instrument, which we'll talk about a little bit up on a few slides, that you can actually use less pressure through the tool, so you're not causing a lot of pain or dysfunction to your client. You can use a lot less pressure through the instrument to achieve the desired results. So it's more comfortable for you. The practitioner has to work less, and the patient is more comfortable in that position. So when we're using the tool over top of those myofascial adhesions, we're training of controlled microtrauma in the affected tissue, which we're going to stimulate local inflammation. The microtrauma initiates the reabsorption of fibrosis, excessive scar tissue. Thus, the healing process are initiated, and in consequence, the tissue can reorganize. So when we do our live seminars, we talk about drywall, that if I punch a hole in the drywall, I need to repair that drywall, just like tissue. If I damage tissue, my body needs to repair my tissue. So when we damage tissue, we need to lay down new tissue to help strengthen it. But when our body lays down that tissue, it lays it down in a disorganized pattern, which can lead to further pain or dysfunction, or even lead to further injury, which we want to prevent. When we're using our instrument, we can find out exactly where those spots of restriction of disorganized tissue are, and we can help realign it, which is going to prevent that injury from happening, and is going to help make my patient move and feel better. So more about fascia. So fascia is a newly thing through fitness and therapy. So the fascia system has been termed by Grants in 1938 as a functional joint because it provides strength, structure, extensibility, and flexibility all in one. It weaves itself through muscles, ligaments, and joints. Not only that, but also the nerves, head, brain, and organ. I consider fascia like sticky wrap, saran wrap, or plastic wrap. If we have that plastic wrap all around our muscles. So in an ideal world, muscles should slide back and forth over one another. So when we have restriction, those muscles will get stuck. For example, we'll commonly see this at the IT band and the vastus lateralis. If I have someone that comes into my office and they are a runner and they have IT band pain, most commonly the IT band is actually adhesed or stuck to the vastus lateralis. So when I'm going into knee flexion, that IT band is supposed to move anterior. If I go into knee extension, that IT band must move posterior. So if I'm adhesed, that IT band is stuck and it can't slide back and forth over top of the vas lateralis. So instead of causing compression like we would with a foam roller, we can use our tool, find exactly where that adhesion is occurring between the IT band and the vastus lateralis, and create more mobility between those two tissues, which is going to more mobility is going to be pain-free, more blood, and our patient is happy. So myofascial adhesions. Fascia is a connective tissue within the body. Think of your entire body wrapped in fishnet hose, both internally and externally, including each individual bone, nerve, and muscle. Over time, that fishnet hose will get entangled and require adjustment. If not, you'll develop impingement. Fascia will work in the same manner. Once the fascia becomes entangled, impingement will occur. It may impinge blood circulation, muscle movement, or nerves in the body, and over time, myofascial adhesions occur as a result of unintended impingements. So the reason why the two things that nerves hate are compression and stretch. If I have a myofascial adhesion, it can cause either both a compression or stretch to the nerve. That's going to cause that pain in that area. So we want to help alleviate the nerve by creating more mobility around the nerve, and we can use that. We can do that by our tool as well. So here's a quick cross section of our actual instrument, again, or of our tissue. Sorry. So we can see that white spot right in the middle. That's a myofascial adhesion. So if I have a lot of those restrictions and damaged tissue, it's going to cause a buildup of those adhesions, which decreases our range of motion, increases our pain, and can lead to further injury. So how do we fix myofascial adhesions? Of course, everybody here is because it's instrument-assisted soft tissue mobilization. When a tissue is damaged, it will heal in a disorganized pattern, forming adhesions and scar tissue. These adhesions will lead to limitations in range of motion and increased pain. Instruments or tools are used to aid the practitioner's ability to detect these adhesions as well as treat them. Instruments and tools are used to restore the quality and dysfunctional soft tissue. This is achieved by introducing microtrauma to the tissues, increasing inflammation, and thereby speeding up repair within the body. So how this works. So scar tissue adhesions prevent the fluid movement of muscles, tendons, ligament, and fascia. As our M2T blade instrument glides over the adhered tissues, the stainless steel tool will reverberate the feeling into our hands. Like a stethoscope applies the sound of the heart, instrument-assisted soft tissue mobilization tools, such as the M2T blade series, assist us in finding the exact areas of restriction. They help us break down scar tissue, and over time this process will reduce or eliminate the adhered fibers, restore function, and decrease pain. So depending on the treatment plan designed for your clients, the M2T blade is used in conjunction with other techniques, modalities, or exercise. Your treatment plan will be based on your assessment goals and will be specifically tailored to you and the nature of your injury. So a little bit about the M2T blade. So it's a double bevel with both a superficial and deep treatment edge. Like we talked about prior, we have one edge of our instrument has a 35-degree cut and the other edge has a 55-degree cut. We do this, what helps take pressure off the practitioner's hands and creates a better experience for the client. So if I'm using the superficial edge, I can attack those superficial tissues with reasonable pressure air thrust technique. If I want to get deeper into the tissues but don't want to apply more pressure, I can use my other edge, which is cut at a 55-degree angle, to help target those tissues. Like we talked about before, is that we actually have 8 treatment points to affect all areas of the body. So you don't need more than one tool. You only need one tool to help affect all areas of the body. We have an integrated handle for increased control and outcomes, can be used in either hand. Now every tool is actually handmade in Canada, so the quality is really high. And we use a stainless steel, we actually use a 0.316 stainless steel. This is a medical grade stainless steel, so cleanliness is a big factor, where if we use a normal stainless steel, like a lot of the cheaper tools use, the metal is actually porous that holds on to dirt, debris, and skin cells. With a medical grade stainless steel, which is the same material they use in hospitals, surgery rooms, the tool is a non-porous metal, so it doesn't hold on to any dirt, debris, or anything else like that. One of my favorite things is the M2T blade is actually used in over 30 countries, so actually in 32 countries now. Actually, we're in Vietnam, and we're actually in Hong Kong, China now. So 32 countries, the most worldwide used instrument on the market, which is very, very cool that we have practitioners all throughout the world that are getting great success from using our program. And yeah, so how do we use the M2T to detect faulty tissues? Once the area of interest has been narrowed down by the assessment, the M2T is used to find specific areas of restriction. When sweeping the M2T over the adhered tissues, there will be tactile feedback felt through the tool into the practitioner's hand. Once the areas of interest are identified, treatment with the M2T can proceed. So treating with the M2T, emollient cream or lotion should be applied to the patient to help prevent skin irritation. Tissue should always be treated from superficial to deep. The M2T must always be held at a 45-degree angle to the targeted tissues. The M2T can be pushed or pulled, but should only be used in one direction at a time. Only moderate pressure through the tool is needed to affect the tissues. If severe reddening of the patient's skin develops, it is assigned to move on to our next area of interest. Now, we're just going to skim through this. If you do our online program, which we just launched a couple weeks ago, or you do one of our live courses or seminars, we go through this fairly in depth, actually how to hold it, how to use it, how to go through the tissues, and all that kind of stuff. This is just a more of an overlay so you can see how it actually works. So, the big thing, how can I prolong my career, increase my treatment outcomes, and make more money? Like we just talked about for the last 15 slides, the answer is instrument-assisted soft tissue mobilization. With instrument-assisted soft tissue mobilization, you can achieve better results by exactly locating where the myofascial adhesion or dysfunction is, create a safe and effective and pain-free treatment, and minimize adhesions, scar tissue, and improve range of motion. The best part is you can prolong your career by taking pressure off your hands. So how? First thing is we can decrease treatment time. So if you're a chiropractor, massage therapist, or a personal trainer. So number one thing that you can do, you can actually spend less time with your client to get a better outcome. So the reason that you can do this is that you will actually locate where the adhesions are. Like we talked about in a few slides before, if you're working with a runner that has IT band friction syndrome or IT band dysfunction, you can locate exactly where that dysfunction is happening and treat it, create an overall increase in range of motion. So if you're a massage therapist, you likely work on the entire IT band, the entire vastus lateralis. With the tool, when we're doing our assessment, you're going to sweep over top of the area, identify exactly where it is, and you can treat that as well to improve that range of motion. Now for timeline, the sweeping takes 10 to 20 seconds to locate exactly where it is. When we do our live seminars or our online program, we actually teach you a functional movement and muscle testing way. So you can actually work on 2 or 3 areas that are causing dysfunction in that area. So if someone comes in with IT band issues, you can look at the glute med, and the IT band, treat all those tissues and increase range of motion in under 4 minutes to help improve that overall outcome. If you're working the traditional way, you may spend 20 minutes to half an hour loosening up all those tissues with your hands. Where if you use the tool, we specifically locate exactly where that dysfunction is, and we can treat it. So you can spend less time with your client to get a greater overall outcome. So again, you can see more clients at a time. So if you usually see 2 clients an hour, now you can maybe see 3 or 4 clients an hour, but still get better results. Next thing is you can generate referrals. Now again, if you go to our m2tblade.com, you actually look at this thing. One of the biggest responses that we get is this looks like a Klingon device or a weapon. So when someone takes our seminar to buy the products, one of the best things that happens with them is they actually get better referrals or more referrals from this because the thing looks so cool. You actually get it in your hands. If you watch our videos on YouTube, the thing looks like it's something out of this world. And if you explain to your patients what you're doing and how it works, it's a very, very simple concept, but it's cool. But a lot of our clients, which are chiropractors, physical therapists, massage therapists, osteopaths, or personal trainers, generate more referrals because their clients will refer to them as the Blade or the Fashion Ninja, or they'll say, "Go to my guy to see that, get that Blade therapy done. It's really, really cool. And it works really well. It's comfortable." So if you educate your patients, and they'll refer to you more often because you'll get better results with that instrument. So we're actually, everybody that takes our program and gets our instrument actually generates more referrals. Next thing is you can leverage yourself as a soft tissue expert. So how do you do this? So again, a lot of our issues can stem from our soft tissue. Now, generating yourself as a soft tissue expert with our instrument is you can do this through events, articles, referrals, or community. A lot of people that get our instrument, they actually can contact local media outlets and local online. They can do a lot of videos and a lot of stuff on their social media platforms and newspapers showing these different treatment techniques and how it almost causes instantaneous results. Now, I really don't like to use the word instantaneous results, but again, let's go back to that runner. This is in Canada, it's a big running season, in a lot of states as well. If someone has that knee pain, we can increase the range of motion almost immediately with our instrument and get them running pain-free within a couple of treatments. So that's going to help leverage you as a better therapist and a better soft tissue expert, that you can get results fast and get people back to their active daily livings. Next thing is going to actually prolong your career. And I know in Canada, at least, for a massage therapist, the average career is 3 to 5 years. In the States, I think it's a little bit longer than that. So the reason why this prolongs your career, it actually saves your hands. So you can be doing more soft tissue work for taking pressure off your hands. So I used to be a big ART guy. Now my hands are really sore and I have a lot of issues with my hands. So now when I'm using the actual instrument, it takes a lot of pressure off my hands, so I can apply less force to those tissues, get that desired result, and still see all the clients that I have been seeing. So it's going to save pressure off your hands, as you can do less work with your hands. Now, are we saying that this replaces your hands? No, this is just an adjunct to what you're already doing. It's just, you can still use your hands. If you're a massage therapist, you still do massage. For chiropractor doing soft tissue work, you can still use your hands. But again, this is just an adjunct to get better results. So you do less pressure off your hands and still get great results and get your clients and patients feeling and moving better. Next, you can increase your price per treatment. So again, we've had a lot of people that actually increase their price because this is a specialization. So if you're charging, say, $55 a treatment, you can now charge $60 a treatment. Now, we may also not also increase your treatment price, you may also decrease your treatment times. So if you spend 15 minutes with a client, now you can spend 8 to 10 minutes with a client. So now you're still charging the same per treatment, but you're spending less with that client, but they're getting better results out of their treatment. Next thing is assistance. So we have a lot of chiropractors, especially in Southern Florida, that have their assistants do the soft tissue work. So their assistants will actually use the blade therapy to work on the soft tissues, and the chiropractor will come and finish it off. So they're charging more for that time the client's in their office. The client's getting better results, but the chiropractor is spending less time with them and getting an overall better experience. Next is also going to be improving your treatment outcomes. So again, this works really well, as like we talked about multiple times. You actually identify the exact area of restriction. So again, you're not guessing, you're not working all the tissues. We're not doing an overall approach. We're doing a very specific approach to soft tissue to help increase that range of motion and decrease those myofascial adhesions. So you're really causing a specific treatment approach to help that client feel better overall. Now, how do others do this? So some examples of what some other people have done. So we have a client called Functional Fitness in Makati. It's a physical therapy trained fitness facility, so all of them are physical therapists in that facility. In their first month of doing this, they actually increased their overall revenue by 30% in their first month. I haven't checked on them since February, but their first month was 30%. How did they do this? Well, first thing they did is they made all their physical therapists a specialty at this, so they actually increased their price because the clients got a better overall experience. Second thing they did is they actually, instead of seeing that client for half an hour, so they saw every physical therapist saw 2 clients per hour. Now every physical therapist sees 3 clients per hour because they need to spend less time working on soft tissues. They can spend more time actually getting better results. So they increase the price and they decrease the treatment time, so you can see overall more volume. The client didn't get any less service, they got better service in a less time. Next is City Gym and Rehab actually doubled their treatment fees. So actually doing this, they spent the same amount of time with their client, but they actually doubled their treatment fees. So now they do less soft tissue work and more exercise work, which let them charge double. So now they would see the physical therapist, they would see the assistant, they can double their treatment fees. They still see them for the same amount of time, but they actually got overall fees. We have an example of we have a Miami massage therapist that actually charges $1,000 per treatment. He still spends that 1 hour with that client, but he primarily does a lot of blade therapy, a lot of exercise, a lot of massage, so he actually charges over $1,000 per treatment. We have another chiropractor in Miami that increased his overall billables to $20,000 a month. How he did this is that he actually had assistants come in, take our online program, which I'm going to introduce you shortly. His assistants use the blade, so he actually get overall more people in to see him. He had to hire more assistants and more massage therapists to help take on the volume with his referrals coming in. He actually increased his monthly bills by $20,000. And again, if you are our online program, I'm going to show you how you can do this as well, is how you can specifically generate those referrals and generate those better treatment outcomes so you get better results and actually grow your business as well. So how can you get access? So we're talking a lot about how you can make more money. So right now we're running a great program, and kind of here's the pitch: is go to this link here. It's m2tblade.com/master-IASTM /. So right now it's $297 until Monday. We normally charge $599 for this program, but up until Monday we're only charged $297. Then Monday it's actually going to go up by about $100. So make sure you get access to it before then. So what do you get for this $297? So you get the M2T Blade, which is about $300 on its own. You get a tape, and you get our online training program. Plus, you get one-on-one training from my team that you actually work with on Google Hangouts, Skype, and work with them. Now, one reason I want to do this webinar is that a lot of people don't just want to learn a new technique. They actually want to grow their business and make more money and make their jobs a little bit easier. And we want to show you guys that that is possible with this program, that you can make more money, you can help more people, and you can get better results for your clients to actually get better results and a better lifestyle for yourself. So again, if you want to get access to this, again, you can email Dan at m2tblade.com, or you can email myself at support@m2tblade.com if you have any further questions. If not, go to this link, sign up for the program. We can get it shipped out to you within the next 24 hours. It's $297. Again, on Monday it goes up by $100, so it's normally $599. For this week it's $297, and then it's going to go up again Monday. So if you have any questions, now is the time to ask. Doesn't look like we have too many questions. So again, we're not going to sit on this for too much longer. We're at about our half-hour mark right now. If you have any questions or concerns, feel free to email our team at support@m2tblade.com, or you can email Dan directly at dan@m2tblade.com, or you can email support@m2tblade.com. Thanks for staying on this webinar. I hope I had a great time teaching. I hope you guys learned a few things, learned more about instrument-assisted soft tissue mobilization. Again, we look forward to hearing back from you guys shortly. Thank you.